Stop what you're doing right now and think about the last time you had your blood pressure checked. Did you sit down and immediately press the button? Were your legs crossed? Had you just walked up a flight of stairs? Did you have coffee earlier that morning? Now, let me ask you something that might change everything you thought you knew about your numbers. What if that reading you've been worrying about, the one that kept you up at night, the one that made your doctor mention increasing your medication, what if that number wasn't actually your real blood pressure at all? I know that sounds impossible. You're thinking the machine doesn't lie. But here's what I need you to hear. Your blood pressure reading is not just about what's happening inside your arteries. It's about how you measure it, when you measure it, and whether you're making any of 7 common mistakes that can push those numbers 10, 15, sometimes even 20 points higher than they should be. After more than 30 years working in emergency medicine and treating over 10,000 older adults, I've lost count of how many times I've seen someone arrive at the hospital convinced their blood pressure was dangerously out of control, only for us to repeat the measurement properly and watch that terrifying number drop back into a completely normal range. Same person, same day, different technique. Today I'm going to walk you through the 7 most common mistakes that change blood pressure readings in adults over 60. And I'm going to show you exactly what to do instead. My name is Dr. Alex Hayes. I've spent 3 decades in emergency and preventive medicine, and my only goal in this video is to give you the truth in plain language so you can take control of your health with confidence. Before we begin, drop a comment below and tell me, do you check your blood pressure at home or only at the doctor's office? Write home or doctor only, and tell me your age. I read every single comment because understanding where you are helps me create videos that actually matter to you. Here's something most people have never been told. Blood pressure is not a fixed number. It's constantly moving. Think of your circulatory system like a river. The pressure in that river changes throughout the day depending on stress, activity, hydration, posture, temperature, medications, even whether your bladder is full. That's completely normal. But here's where it gets tricky. Most people assume a blood pressure monitor works like a thermometer. You check once and you get the answer. That's not how it works. Blood pressure measurement is incredibly sensitive to conditions. After age 60, this becomes even more critical because your arteries naturally become stiffer. Your body's ability to regulate pressure becomes less flexible. And something as simple as reduced thirst sensation can influence your hydration status throughout the day. All of these factors mean that technique matters a lot. A reading that appears high may reflect the conditions of measurement rather than what's actually happening in your body. Now, that doesn't mean you should ignore elevated readings. It means you need to learn how to measure correctly so that you and your healthcare provider are working with reliable information. Let me tell you about someone who learned this the hard way. Margaret was 72 years old, from Columbus, Ohio. She came to see me absolutely terrified about her blood pressure. Every time she checked it at home, the numbers seemed higher than the last. Her cardiologist had told her the readings were concerning. They were discussing adding another medication to the 2 she was already taking. When we sat down and reviewed her daily routine, something jumped out immediately. Margaret was checking her blood pressure while standing in the kitchen, sometimes right after climbing the stairs, sometimes while talking to her husband, sometimes immediately after folding laundry. The readings were all over the place because the conditions were all over the place. We made one change. We created a simple, standardized routine. Same chair in the living room, same time every morning. 5 full minutes of sitting quietly with her feet flat on the floor and her back supported. No talking, no television. Then she would take the reading with her arm resting on the side table at heart level. 6 weeks later, Margaret came back smiling for the first time in months. Her readings had become dramatically more consistent. Her average blood pressure was 15 points lower than what she'd been recording before. No new medications, no miracle cure, just proper technique. That's what accurate measurement gives you. It gives you clarity. It gives you control. Now, let's get into the 7 mistakes, so this can be your story too. Mistake number 7, talking during the reading. Let's start with number 7, talking during the measurement. Picture this. You're sitting at the kitchen table. The cuff starts to inflate. Your spouse walks in and asks what you want for dinner. You answer. The machine beeps. You write down the number. Seems like no big deal, right? Wrong. Here's what's actually happening when you talk. Speaking activates muscles in your chest, your throat, your diaphragm. It changes your breathing pattern. It stimulates your nervous system. Research published in the journal Hypertension has shown that talking while your blood pressure is being measured can increase the reading by approximately 10 millimeters of mercury or more. 10 points. That's enough to push a normal reading into the pre-hypertension range. Think of it like trying to weigh yourself while holding a bag of groceries. You're no longer measuring just your body weight. The same thing happens with blood pressure and talking. You're measuring your pressure plus the effect of muscle activity and nervous system stimulation. Here's what you need to do instead. When you sit down to measure your blood pressure, commit to complete silence. No television in the background. No phone calls. No conversations. Sit quietly, breathe normally, and wait until the measurement is completely finished before you say a single word. That one simple change, staying silent, can bring your readings closer to what your blood pressure actually is when you are calm and at rest. Mistake number 6. Crossed legs and poor posture. Now, let's talk about mistake number 6. Crossed legs and poor posture. Most people sit down, get comfortable, cross one leg over the other, maybe lean forward a little bit, and then take their reading. It feels natural. But here's the problem. When your legs are crossed or your back isn't fully supported, the dynamics of blood flow change. Think of it like pinching a garden hose. Your circulatory system responds in a similar way. Crossing your legs restricts blood flow. That sends signals to your cardiovascular system to adjust. Multiple clinical studies have confirmed that crossing your legs while having your blood pressure measured can increase the systolic reading by several points. For older adults whose circulation is already less flexible, the effect can be more pronounced. Now, combine that with poor posture. If your back isn't supported, your core muscles have to work to keep you upright. All of that activity creates enough physiological change to move the numbers. I've had patients whose readings dropped 8 to 10 points simply by uncrossing their legs and sitting back fully in the chair. Here's the correct way to sit. Choose a chair with a straight back. Sit all the way back so your spine is supported. Place both feet flat on the floor. Do not cross your legs. Do not cross your ankles. Let your shoulders relax. This isn't about being rigid. It's about creating a standardized position that allows your cardiovascular system to settle into a true resting state. Mistake number 5. Measuring with a full bladder. Mistake number 5 is one that almost nobody talks about, but it can have a surprisingly large effect. Measuring your blood pressure with a full bladder. When your bladder is full, it creates physical pressure inside your abdomen. That pressure activates your sympathetic nervous system, which is your body's alert system. And when that system activates, it can temporarily raise your blood pressure. Studies have shown that a distended bladder can increase blood pressure readings by 10 to 15 millimeters of mercury in some individuals. That's enough to make a normal reading look borderline, or a borderline reading look like it needs treatment. After age 60, this becomes even more relevant because bladder function naturally changes. Many older adults experience increased urinary frequency. If you're checking your blood pressure first thing in the morning before you do anything else, there's a very good chance your bladder is at least partially full. I've seen this pattern dozens of times. Someone has consistently elevated morning readings. We discover they're checking immediately after waking up, before using the bathroom. We make one small change. Use the bathroom first, wait a few minutes, then check. And suddenly the morning readings drop significantly. Here's what you should do. Before you check your blood pressure, especially in the morning, take a moment to use the bathroom. Empty your bladder completely. Wait 2 or 3 minutes. Then sit down and measure. It's such a simple adjustment, but it removes a variable that can quietly push your numbers higher. Mistake number 4. Not resting before you measure. Now we come to mistake number 4, and this is probably the single most common error I see. Not resting before you measure. Picture this. You've just carried groceries in from the car, or you've walked up a flight of stairs. You sit down, immediately press the button, and the reading comes back high. You panic. But here's what actually happened. You measured your body's response to activity, not your resting blood pressure. When you move, your heart rate increases. Your blood vessels adjust. After age 60, it often takes longer for your body to return to a true resting state after activity. If you measure too soon, you're capturing a moment of transition rather than a moment of rest. Research has demonstrated that inadequate rest before measurement significantly increases blood pressure readings. The guidelines are very clear. You should sit quietly for at least 5 minutes before taking a reading. 5 full minutes. Not 1 minute, not 2, 5. Here's the exact protocol. Find a quiet, comfortable place to sit. Sit down, with your back supported and your feet flat on the floor. Set a timer for 5 minutes. Close your eyes if it helps. Breathe slowly and naturally. Don't check your phone. Just be still. After 5 minutes, take your reading. If the first reading seems high, wait another minute and take a second one. This isn't optional. It's part of proper blood pressure measurement. Mistake number 3. Incorrect arm position. Mistake number 3 is something I see constantly, even in professional healthcare settings. Incorrect arm position. Where your arm is positioned during measurement has a significant impact on the reading. If your arm is too low, the reading can be falsely elevated. If it's too high, the reading can be falsely lowered. The reason has to do with gravity and hydrostatic pressure. The standard for blood pressure measurement is that the middle of the cuff should be positioned at approximately the same level as your heart. If your arm is hanging down by your side, below heart level, the reading will be higher than it should be. If your arm is raised too high, the reading will be lower. Research has shown that even modest changes in arm position can change readings by several millimeters of mercury. Here's the correct technique. Sit in a chair next to a table or desk. Rest your arm on the surface so that the middle of your upper arm, where the cuff sits, is roughly level with your heart. If the table is too low, place a pillow or cushion under your arm. Your arm should be relaxed. Don't hold it up yourself. Just let it rest naturally in a supported position. Mistake number 2. Using the wrong cuff size. Now we're at mistake number 2, using the wrong cuff size. When you buy a home blood pressure monitor, it comes with a cuff. Most people assume that cuff fits everyone. It doesn't. If the cuff is too small for your arm, it can squeeze too tightly and produce a falsely elevated reading. After age 60, arm size can change for a variety of reasons. Weight gain or loss, muscle atrophy, fluid retention. A major study published in JAMA Internal Medicine found that using an inappropriately sized cuff could lead to errors of 15 to 20 points in some cases. That's the difference between normal blood pressure and stage 2 hypertension. That's the difference between no medication and multiple medications. I had a patient whose home readings were consistently in the 160s/90s. His doctor was talking about adding a third medication. When I asked him to bring his monitor, I immediately saw the problem. The cuff was too small. We switched him to a large cuff. His readings dropped to the 130s/80s. Same man, same blood pressure, proper cuff. Here's what you need to do. Measure the circumference of your upper arm at its widest point. Check the sizing guide that came with your monitor. If your arm measurement is outside the range for your current cuff, you need a different size. You can purchase replacement cuffs from most pharmacies or online. This is not an expensive fix, and the peace of mind is priceless. Mistake number 1, checking at inconsistent times. And now we've reached mistake number 1, checking your blood pressure at inconsistent times throughout the day and then comparing those readings as if they should all be the same. Here's the truth. Blood pressure is not a fixed number. It follows a daily rhythm. It's naturally higher in the morning. It tends to drop slightly in the afternoon. Comparing a reading you took at 7 in the morning to one you took at 8 at night is not a fair comparison. Many people check once on Monday morning, once on Wednesday evening, once on Friday afternoon. The numbers are all different, and they conclude something must be wrong. But nothing is wrong. They're just seeing normal variation. The solution is consistency. Here's the protocol I recommend. Choose 1 or 2 specific times each day to check your blood pressure. For most people, first thing in the morning before breakfast and medications, and then again in the early evening before dinner, works well. Use the exact same routine every time. Take 2 readings 1 minute apart and record both. Do this for at least 1 week, ideally 2. Then look at the average of all those readings. What you'll discover is that your blood pressure has a pattern. And once you understand that pattern, you can have much more informed conversations with your healthcare provider. Consistency gives you clarity, and clarity is what allows you to take control. So here's exactly what I want you to do starting tonight. Find a comfortable chair in a quiet part of your home. Place a small table next to it where you can rest your arm. Make sure the cuff is the correct size for your arm. Tomorrow morning, before you have coffee, before you take any medications, use the bathroom. Then sit down. Set a timer for 5 minutes. Close your eyes, breathe slowly, and let your body settle. After 5 minutes, rest your arm on the table at heart level. Take 2 readings, 1 minute apart. Write them both down, along with the date and time. Repeat this process at the same time every day for 2 weeks. At the end of those 2 weeks, calculate the average. That number is a far more accurate reflection of your true blood pressure than any single measurement you've taken before. This process costs you nothing and gives you something invaluable, which is accurate information about your own body. Before I close, let me be absolutely clear. This video is about improving measurement accuracy. It is not a substitute for medical care. If you experience chest pain, severe shortness of breath, sudden weakness, new confusion, fainting, vision changes, or any symptoms that concern you, seek medical attention immediately and never stop or change blood pressure medications based solely on home readings without consulting your healthcare provider first. So let me leave you with this. High blood pressure is serious. It's a major risk factor for stroke, heart attack, heart failure, and kidney disease. But inaccurate blood pressure readings are also serious because they lead to unnecessary worry, inappropriate treatment decisions, and a loss of trust in your own body. You deserve measurements you can rely on. I've seen people spend years worrying about readings that were influenced by poor technique rather than actual hypertension. I've also seen people gain tremendous confidence once they learned how to measure correctly. It's never too late to start. If this video gave you something useful, please like it and subscribe to the channel. Share it with someone who checks their blood pressure regularly, because chances are they're making at least one of these 7 mistakes. Now, I want to hear from you. Tell me in the comments, which of these 7 mistakes surprised you the most? And which one are you going to fix first? I read every comment because your experience helps shape what I cover next. Until next time, take care of yourself. You deserve the effort.